Welcome to Montgomery Smashing the Stigma, a podcast that shares stories about mental health and wellness and connects people with groups and solutions to help smash the stigma about getting help.
Hi everyone, I'm Connie Gaylor, and welcome to Montgomery's Smashing the Stigma podcast.
And I'm Amy Frederick. Joining us on the podcast is Brian Valasek, steward and owner of Beyond Your Valley. Beyond Your Valley is located in Blue Ash, Ohio. It offers mental health counseling, psychiatric services to overcome trauma, addiction, depression, and anxiety.
Today we want to talk about the difference between counseling and psychiatric care.
Thank you for having me. The difference between counseling and psychiatric care, counseling is talk therapy. You also will hear it called therapy. So behavioral health counseling, mental health counseling, therapy, sort of interchangeable in many respects. But essentially counseling is talk therapy designed to help you cope with things better, whether it be anxiety, depression, stress, life, transition. But also, it is to help you find out the core of what generates those problems that you encounter and what perpetuates those problems. So getting to the core is what we like to focus on, because if you understand why things happen, how things happen, you don't have as many problems that proliferate. And so you can understand yourself better, really become yourself is really an ultimate aim of counseling. Because we do so many things that take us away from ourselves from day one. Mm-hmm. And then the goal is to get back to yourself, the full version of yourself.
So, and that makes total sense. So when does that spill over to the need that maybe if you have a client come in and they share their story with you and you hear their story, when does it transition from, okay, we're in talk therapy, but now I feel like there's a need for psychiatric care?
Well, I think if you run into obstacles in therapy mm-hmm. repeatedly, you may find benefit from medication, would be one way to say it.
Okay.
Depending on why you're running into those obstacles. There's a lot of therapy traps where therapy can just turn into talking, could just turn into venting. Somebody could forget the core part and just help you be coping with stuff, so that you have to keep coming back and there's a dependency that develops. So, but in general, if the problem persists or intensifies and it's out of control, like that becomes a crisis situation where you can no longer handle it yourself. You talk to your resources, you talk to your therapist, you talk it through, and it's just not making the impact that you want it to see. Then you would probably go see a psychiatrist or a psychiatric provider for an evaluation to see if medicine would be the right answer, and if so, which ones.
And you offer both at Beyond Your Valley.
Yeah, we do.
So do you often have counselors and psychiatric care together as in conjunction treating that one client, so it's kind of a holistic approach from both sides? Absolutely,
we do that as often as we can. Of course, the client is in charge, mm-hmm. right? In many respects. So if you're, I tell my clients, if you're driving yourself off a cliff, I'm going to tell you, and if I'm driving you off, I want you to tell me. But essentially, yeah. So we will work in conjunction as often as possible. It's interesting that you say that. Will the psychiatrist or psychiatric provider work with the therapist? Sometimes that's why I like nurse practitioners. So that's why I say psychiatric provider. I mean psychiatric nurse practitioner. They are trained in therapy as well, so they'll do a bit of that themselves. And then if they feel out of their scope with that because of time or frequency that they need to see, then it's like, okay, we're going to do some core work over here with your therapist. Trauma therapist, for example. Mm-hmm. Did that answer your question?
Yeah, it did, because I feel like people need to understand that sometimes you may start at A and it may lead you to B. Mm-hmm. And so knowing that that they're closely related, and the difference too, would give them some, maybe some security of knowing when they come to Beyond Your Valley or any other practice that it's kind of a seamless transition when the need arises. Mm-hmm.
Hopefully we're paying attention to that. Everybody's paying attention to that. You can also start with B and then go to A. So when people ask, where do I start? The answer is you start somewhere.
Right.
That's not the end-all be-all answer, because it could be the less optimal place. Like there is a bias out there. So if you go to a psychiatric provider, some psychiatric providers like to prescribe medications. So they might find an issue that doesn't really exist, or I see bipolar all day long. They see bipolar all day long because they look for bipolar all day long. So you do want to be careful about where you start, but if it's done properly, it's okay to start there and then go to the next thing. It happens all the time where people seek out medication and then therapy, and not therapy then medication.
Okay. So it can go in either direction and be successful.
Yeah. And it's not just counseling and psychiatry. I think we might end up talking about some holistic kind of thing. So you've got spiritual health, you've got emotional health, mental health, you've got all these other resources and people you can go to that are not professional, but that can help you, that can be your people.
Right,
Yeah.
they can be your source of support.
Absolutely.
And that was a great segue, because we've talked about the terminology that's used these days. Do we refer to it as mental health, mental illness, mental wellness? Can you provide some education for us on what those terms mean, or even if just kind of what the general use of those are?
I can give you my opinion.
Okay.
Because there's each word sends you in a different direction, and it sends each individual in a different direction. I consider mental illness a sort of the biological things that happen that are more like bipolar disorder, schizophrenia. Those conditions in particular have more of a biological neurochemical basis, as far as I understand. Where you're talking about mental health, so you say, who needs counseling? The answer is everyone. The answer is, and that's not a joke. That's like, who could benefit from? It's the wrong question. Who needs therapy? The right question is, who could benefit from therapy? The answer is everyone. Why? Because we all have a narrative that needs redesigned to get us closer to who we really are. It got thrown off somewhere, somehow along the way. I like mental health or mental wellness, although it's not inclusive. What about emotional wellness, right? I think more in terms of, when we say holistic, I think of more of the Samska's 8 dimensions of wellness. I can never remember all 8 off the top of my head, need a chart, but it's physical, spiritual, social, occupational, mental, at bare minimum, an understanding of your mental, the way you think, and the way you feel. The reason I say emotional wellness is kind of like another level of depth. That's why we talk about feelings so much, because we're guided by our feelings. We do what our feelings tell us to do, whether they're telling us the truth or not. So it's important to understand what they're actually telling us and if it's true or not.
So that's the benefit of the talk therapy, is you have to talk through those feelings to get to what your real mental health, emotional health is, because it can be congruent with each other.
Yeah, exactly. Well said. You're trying to get those in alignment, and when they're not, that's a problem. Yeah. You don't have good outcomes for your life.
So when you said everybody could benefit, I'm curious. So what does that look like? If I come to you, what does a session look like? Because I think older times people have this, like you said, already a narrative in their head about me laying on a couch, spilling out my problems, just talking. And there was a certain stigma around that. But today I think it's really different. People are going just to feel, to feel better. So if I came to you, what would a session look like?
Our classic answer is it depends. It depends on how I roll, and it also depends on what you need. Hopefully we try to get those congruent to where I can adapt to what you need. A good therapist will help you get what you need, not what you want. So that's why I say co-create a treatment plan, because your goals, I cannot align 100% with your goals, because some of them might not take you where you need to go. So at the end, it depends, Amy. So it depends on what you've brought in. and what you're trying to accomplish. I'm going to keep saying coping and core probably over and over, because a lot of people come in to feel better. Well, if your goal is to feel better, that could be problematic. So any number of ways that I try to help you feel better, I could be enabling, assuaging, I could be doing all kinds of things that don't actually help you transform and grow in the process. The point of a problem is to help you grow. A lot of people think the point of a problem is a problem. And so a lot of therapists think that too. So they'll just help you be wary because if that therapist thinks the problem is just a problem, they're going to help you solve your problem. And guess what you're going to have? You won't have learned anything about yourself and how to deal with problems. So that's the core stuff. So every chance we get, we try to look at the core and more of a coaching mentality of how can you take it to the next level. It's not like you're broken, you need to be fixed. It's like you're already doing great. How can you do better and use what you have? We're tapping into that.
You almost have to destigmatize the treatment.
Yes.
So that you can destigmatize it altogether so that people will seek treatment. Because if they're worried about going in and just meeting with a therapist or psychiatrist, they're not going to do it because they're already just afraid of that, more or less sharing their story.
Yeah, people think we are by nature fairly non-judgmental. I probably am extremely non-judgmental, I think, but people still believe that they're going to get judged in our room. It just doesn't really happen. And where we do have those biases, we do the best we can not to like steer you that way or let it interfere with what we're doing or something. But yeah, everybody is afraid of the same thing, of being judged.
Yeah.
Because we're all afraid of the same thing, disconnection.
Mm-hmm.
So for people who, and I know Beyond Your Valley offers wonderful services, but for somebody listening outside of this area, what's a great way to find somebody like you?
Word of mouth is always the best, so that's why it's important that we talk about this and you openly talk about if you've had a good therapy experience or a poor therapy experience. It's important to talk about that. A referral from a trusted friend is probably the best, but harder to come by. Then you have the good old internet, so you're Googling therapist near me, and like, for example, if you Google therapist near me, we might not come up because I didn't do my SEO very good yet. So we're word of mouth primarily right now. We're aiming to fix that. But so basically, therapist near me, Psychology Today is used a lot, although it has diminishing utility. A mental health match. There's online directories. If you're looking for a specific type of therapy, if you're savvy enough to know what type of different therapies are out there, then you can look for that particular type of therapist that uses that theoretical orientation to do their work. So yeah, directories, and then if you're wanting to use insurance, although they're getting better than they were they used to have. They were all over the place, inaccurate information, old, outdated. But it's getting a little bit better as a place to find, okay, who are my therapists in my area. And like you said, the state near me, a state over from me, you said, right?
Right.
You can see anybody in Ohio. If you're sitting in Ohio, you can see any licensed provider in Ohio. They can be in Florida or Bahamas or Ohio. There's so many choices of people that you can see. So it actually becomes harder to pinpoint. So you really have to know what you're looking for. And it's not easy.
Have you seen a big uptick in new patients and new clients in the last few years since COVID? I mean, do you feel like, everybody's saying, COVID, social media, all of this is raising, the need for talk therapy or for psychiatric care. Or do you feel like it's something that once somebody starts, in treatment, that it's just a continual lifelong thing to truly find the benefit in it? Because I think sometimes people see this as they would see their medical doctor. They're going to go and get treated for that one thing and then they're going to be healed. But this isn't the same.
No, this isn't the same. This isn't the same at all. I mean, that would be one of the traps is you stop when you feel better, as if feeling better, the problem is solved. Feeling bad was the problem. Feeling good is a solution to the problem. Growth and transformation is a solution to the problem that you come to therapy for. That's always on the table. So I keep saying that bit, but it's so. I want people to know that they can do it that way, but what you're leaving on the table is like freedom, growth, transformation, authenticity of becoming yourself, and what the impact and ripple effect that they can have to your family, your community is unbelievable. So why stop there?
So they can learn these coping skills, or sometimes, like you said, it's just getting to know yourself. Maybe you didn't know, you don't know your core self well enough to know how to come out of a situation or lifetime thing that you've been dealing with. Right. And that is the goal of talk therapy and or psychiatric care. So
to answer your question, some people would be, it would be a lifelong commitment to because you sort of get, I don't want to say addicted, but you get kind of a hunger for more. You want more for yourself, and you see it gets more nuanced as you go. The further you go with it, the more understanding, the more, you know what I'm saying? The more nuanced it gets with your goals and objectives, because you've knocked out some of the other ones, and those are you're cranking with those pretty well. So some people it's life, some people they just needed a shift in their mindset, and it starts to change the narrative, and the actions stem forth sort of organically from that. You don't have to spend a lot of time. You got the momentum, go. And most of us take more of a hands-off approach in terms of, I believe in your capacity as a human being to do great things, so why do I need to hold your hand? Get you some momentum, you got the ideas, the mindset, the tools, go after it, go get it. You can always come back if you hit a wall again, right? So it really depends on your goals and all kinds of things, but it doesn't need to be lifelong. Some people would benefit from going further, though. Yeah.
So you treat the individual, you treat families. I mean, I'm sure you have families that come in for this. Where do you think you feel your biggest service is? Is it in one specific area there? Is it just counseling? Is it the psychiatric or?
Oh, at Beyond Your Valley specifically?
Yeah.
I mean, our biggest service is the way we do counseling. It's largely individual. We do have couples therapists and family therapists. Our bread and butter, the way we started this was therapy. We have excellent psychiatric providers who have that same kind of mindset about believing in people and their abilities. But yeah, we're individual counseling with a coaching bent, which means we know you can take it to the next level, and we're on board with you to do that.
One thing I saw on your website that I found was interesting that I'd never seen before was self-esteem. Can you, because I think a lot of people could benefit, especially with the internet and social media out there. What kind of things do you talk about, and what kind of, I know you said everybody should come and therapy is good for everybody, but how does self-esteem, how do you talk to somebody about that? Because I know a few people I think could benefit from that, just themselves. I'm just wondering what that looks like.
Well, first of all, I think the counseling in general, just talking with a therapist, should boost your self-esteem, because they are seeing the best parts of you, reflecting those back to you, and allowing you to be yourself, all the flaws and everything. So you're not shaming yourself for the flaws. You're explaining where did they come from, right? And so the process itself increases self-esteem, reduces shame, and increases self-esteem. That's not often enough in and of itself. There needs to be direct work on self-esteem. And so when I work with people, it's where do you get your validation from? Is it internal? Is it external? For all of us, we have some measure of external validation. I probably have some external validation. If after this you say how wonderful I did, I'll be like, okay, that's cool, I did great. So we need that to some extent. So yeah, we talk about where do you get your validation from? We talk about what kind of connections do you have with other people? And we try to help people understand their values and priorities, morals, character, and ethics, and to live in alignment with that. So when you start to compromise those, it starts to You're not yourself anymore, and so you feel like you have to be somebody else.
I think that's an excellent point. I'd never thought of it that way. And I think just hearing yourself speak about things and the changes you want to make, I think it would help you. I guess in my mind, I just see all these people on social media and they're looking for validation, they're looking for likes, and then they always walk away thinking that they're not enough. Mm-hmm. Mm-hmm. So I think it's interesting that you offer that and that you speak about that. And I've never thought of as therapy as a whole as something that would help you build your self-esteem. What other kind of, you mentioned holistic approach. What are the other holistic approaches that you take? Like you said, did you mention religion and some other?
Yeah, spirituality. Spirituality is big because essentially, I was talking about this today. So spirituality, especially the Christian faith, is unique because God said you're pre-approved. And so you don't have to get it from anywhere else. You don't have to get your validation approval from anyone else. You get it from God. And so that can be huge. If I am able to use that with clients, it's next level stuff. If I can't use that with clients, it's one arm tied behind my back. Because so it's holistic. Spiritual component, whatever that looks like for you. But if spiritual defined as something outside of yourself that you lean on, because it's not that you can't do it yourself. We weren't designed to do it ourselves. In America, we think we were told we were supposed to do everything ourselves. So we've become not dependent, which is good, but we're not interdependent, which is bad. We are independent to a fault. And so we don't ask for help and we stuff it inside. We tell ourselves we should be able to handle everything. And when you can't, you fall short. So basically, talking about what is therapy? Therapy, you could have a litany of therapists come in here, and they're going to come at, well, I do ACT, IFS, EMDR, I do this, I do that. It's all, you have a narrative that says you're less than, and you're trying to, and then how do you respond to that? How do you change it to a narrative that says that I am enough, and then behave accordingly in your life? So integrating spirituality that says you are worthy inherently disrupts that narrative that we've built for ourselves that ain't working.
Which is very hard these days because there's so much, especially with our teenagers or young adults, there's so much comparison that makes them think they are not enough. Mm-hmm. And, so every good thing they do, they find something to compare to, and they will take themselves down a notch. Mm-hmm. So like Amy, I think it's great that you really hone in on helping them to develop that and skills to cope when things don't go right, that they don't fall back into that comparison narrative, and they're able to work through it and cope through it. That's absolutely right. Because you will. You don't. When I say transformation, you still might have that in the back of your head, and it still might come under periods of intense stress or an important relationship. It might come up again, and then you have to go, you have to swat that away. That's not true. Mm-hmm. This is what the truth is, and you get back to it. So, yeah. So it's refocusing your thinking.
Yeah, it's a lot of that. Yeah.
So if you were going to tell somebody, you're making a pitch for yourself, what's the difference between what we talked about, therapy, and then psychiatric care? What do you want listeners to know?
I want listeners to know that wherever they start is okay, and whatever you feel you need, you can get. We are out here to help you cope better with things and to understand yourself better and get to a next level. If you need psychiatric support, psychiatric medications to help you along the way, that's what you need. Do that for yourself. It's important.
You're such a calming demeanor. I can see why people call you and want to talk to you. What's the best way for people to reach you?
The best way to reach any of us at the practice is through our website. On there's a website form. So beyondyourvalley.com. There's a contact form that will go to one of our client experience coordinators, Joanne, Maddie, or Andy, and they will get back to you promptly. You can also call 513-348-1780, or just email Joanne directly at joanne@beyondyourvalley.com.
Thank you for joining us, Brian, and we want to thank you for listening.
Thank you for listening. If you or a loved one are in a crisis and need immediate help, call or text the Suicide and Crisis Lifeline at 988.